the amount of stuff that's
10 a.m. to 2 p.m. on Gold 905.
A very good evening to everyone. Welcome to Dr. Lowly's second talk show. I hope you will have an enjoyable evening tonight because we're going to talk about very smelly stuff tonight. So be prepared for something really exciting yet very yucky because we're going into intimate detail about what you produce. Today with me is Dr. Gwee Kok Ann. You see the beautiful picture here? Dr. Gwee is a very famous specialist. Okay, he currently works for MLE, and he is the. His resume is so long that I have to come near here to see. He's a member of the Rome Committee that publishes international guidelines for research and management of functional gastrointestinal disorder. See, even I have problem pronouncing it now. Okay, he's also the immediate past president of this Asian Neurogastroenterology and Motility Association. Quite tough to pronounce all these difficult words. Okay, and of course he was a recipient of this very famous Rome Foundation Research Award 2014, and he's also currently a young professor of medicine at NUS. And of course, he's very interested in many things. Among the things that he's very interested in is actually, all the bacteria in our guts, all about poo, all about the intestine. So today we are very happy to have Dr. Gwee with us as our guest speaker, and of course, visiting consultant. He's going to share with us about Irritable Bowel Syndrome. But before we start, can we invite Dr. Gwee now to join me? And I would like to have maybe 2 or 3 volunteers. One lady at the back. One of you? Anybody? On this side? I know, that Indian man there. Raj. You are too prominent, I cannot meet you.
Yeah, of course.
Please volunteer yourself because you are going to receive very exciting prizes today, okay? So we have one gentleman here. I call him because I know Indian take a lot of yogurt, right? Am I right? Yeah. I want to see whether, are there any difference among Indians and Chinese or not? So now can I have a Chinese? Any Chinese guy here? Come. Don't be shy. Okay. How about you? Come. I would love to have the ladies, but we are going to talk about very, active things. So I may sound a bit offensive if I involve a lady. So I hope, ladies, you don't feel left out, right? Or you're actually more than happy to be left out. Okay, with this, let's get started, okay? Can I ask you guys a question? How much time do you spend in the toilet every day? How much time do you spend, on the toilet bowl every day? A bit personal, but I don't think you mind. Huh?
Yeah, about 10 to 15 minutes.
Huh?
10 to 15 minutes.
10 to 15 minutes. What do you do on the toilet bowl?
Normal stuff lah.
What?
Shit.
Do people do abnormal stuff on the toilet bowl? What kind of normal stuff do you do?
Shit.
Oh, okay. Poo, right? Okay. He used a bit of, not so nice term, but it's poo lah, okay?
Okay.
I know of people who spend, half an hour, 2-3 times a day just on the toilet bowl. Can you believe that? How about you? This gentleman here.
Cumulative time or
No, let's say every day.
Every day per time?
Mm.
Maybe about 10 minutes? 5-10 minutes?
5-10 minutes. That's not too bad. And how much time do you spend eating every day?
Eating? About half an hour each meal.
Half an hour to eat. You?
Yep.
15 minutes.
15 minutes. Anybody take longer than that? Okay, cumulative. Okay, when you get to say 75 years old, our normal lifespan, how much time do you think you'll be spending eating your whole life?
Whole life.
Ha 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 ha. Thinking. Anybody got an answer for me?
Uncomfortable.
Cannot calculate. Really?
Yeah.
Okay, we shall try to.
After you bunch.
Okay. How much time do you think you spend on the toilet bowl then? The whole life. You can't believe. Make a guess, come. Thinking. You need a calculator? Anybody got an answer? Or should we ask the expert? No need to ask the expert lah. This one common sense, okay? Just take your calculator. You spend 10 minutes a day times 365 days times, 75 years old. You know the answer. Let me tell you, you spend an average of 5 years of your life eating. And you know how much time you spend on the toilet bowl? The whole life? 3 years. For some people, even longer. They bring the newspaper into the toilet. And then, after that, they bring it and put it on the breakfast table. Then the wife will flip, you also flip. Then they enjoy themselves. All the smell, it's quite nice actually. You add on to the aroma of the food, right? You spend 3 years of your life on a toilet bowl. You jolly well make it, productive. Read something, right? That's why people read. Singaporean very busy, so must always do double up, like multitasking. So the iPhone will always go with you, right? So that's why the iPhone is one of the most dirty things. You know that? The other most dirty things that is on our body is actually our mouth. You know that there are more bacteria in our mouth than the entire population of Canada and US combined. You combine the population, count number of bacteria in our mouth, that's how many millions of bacteria in our mouth. Amazing, right? And humans actually spend a lot of our time, our life eating. Do you know how much food you eat in your whole life? Make a guess. That's why our earth is running out of material for us, I can't believe it. When I did a computation, I was stunned. Make a guess, how much food you eat a day? Thinking. Interesting question, right? Now you know where all your money go to. Let me do a calculation for you, okay? In your whole life, you'll be eating about 7,000 times your body weight of food. Meaning that if you are 50 kilograms, you are going to have eaten, by the time you die, 350 tons of food. Is that a lot? Is that a lot? It's a lot. And of course, a lot of them get converted to energy. But how much got excreted? We are very good at producing stuff, You know how much do we produce? The amount of poo that we produce in our whole life? Make a guess again?
It's a lot.
Right. That's why a toilet business is such a big business. They even call 19th of November the World Toilet Day. Because human beings spend so much time on the toilet bowl producing stuff. We produce on average about 5 to 7 tons of poo our whole life. That's equivalent to the weight of 2 vehicles. Amazing stuff, right? Solid stuff, smelly stuff. Now you know. But poo is a big business. Today we are going to be talking a lot more about this common problem that people face. A lot of people, they go to toilet. It's not a nice event. It's not a nice experience. A lot of people, when they go to toilet, it's suffering. They got cramp. You got cramp before?
Yes.
So what happened? Every month, is it?
No.
Sorry.
Once in a blue moon.
Once a blue moon.
Yes.
What happened when you get cramp? Is it diarrhea or is it constipation?
Diarrhea is quite
Quite normal for you,
right?
right?
Yeah.
So because of what? The food you eat?
It depends on the food you eat, that's right, yeah.
And you?
Once a while.
Yeah. So there are lots of people who suffer in silence, because going to the toilet can be a very painful experience. Some people are so painful, they literally want to faint. They get cold sweat, And some people bleed. It's so painful. Some people, they go to the toilet, they are so embarrassed because they let out a lot of gas. So they have to flush all the time to camouflage the sound and all that. You all know that, right? Yeah. I also know ladies who bring perfume along whenever go to the toilet, spray. So it come out even smell better than usual. But do you know that to produce a poo involve all the organs in our body. The food that we eat, within 8 seconds will travel down the gullet. Within 3 to 4 hours will pass through what we call the intestine and spend the next 3 to 4 days in the colon. Intestine is a very exciting part of our body. And this is the one that makes our Dr. Gwee a professional here today. Okay? Because people suffer because their intestine malfunction. Although structure related to the intestine malfunction. You know how long is our intestine? Make a guess. How long is our intestine? You know our intestine as a part of education. You know when we eat our food, it goes to the mouth. Then after it passes through what we call the esophagus. The layman term we call it the gullet. And after that, it goes into the stomach. And the stomach is a very acidic bag. And then after that, the food goes into a C-shaped thing called the duodenum. Then from there, it goes to another structure called the jejunum. Then the jejunum will become the ileum. Then the ileum, a very long structure, will finally end up as the colon. Okay, before it becomes the rectum and then finally the anus. And finally, that's where your 5 to 7 tons get produced. Imagine the elaborate passage that the food has to go through just to come up into the toilet bowl. Amazing, right? But how long do you think is our intestine? 7 meters.
7 feet.
7 feet. How long is 7 feet? Let me explain to you how long is our intestine. I need a volunteer here. Okay, can you gentlemen here hold this string? And then can you just walk all the way there? This is the length of our intestine. 6 meters long in total. Amazing, right? How God stuffed this entire 6 meter length of intestine into this little cavity. And now you know why some people's tummy is like bigger than normal? No more space, so bak chok lor. Especially if you eat a lot. This is the length of intestine. 6 meters long. Amazing. And amazing part is, women generally has slightly longer intestine than men. I don't know why. Maybe they eat more. Amazing. And our colon, the structure here, this structure, the intestine, 6 meters long ends here. Then it starts with the cecum, the appendix is here. And then go up what we call the ascending colon, then the large intestine, transverse colon, then the descending colon, then the sigmoid colon, which is called the S-shaped thing. Finally, becomes the rectum where the poo are stored. And then become the anus. You know how long is the colon? This is like 1.5 meter long. This is how long is the colon. Amazing structure. And this is where all your poo come from. And this is where we are going to talk about today, because a lot of people suffer from painful condition called Irritable Bowel Syndrome because of malfunction somewhere in our body structure. And all the 5 to 7 tons of poo that you produce every day, after today's lecture session, I hope you pay more attention to all the things that you produce through that 6 meter long intestine and then finally the 1.5 meter long colon. Pay some attention. You got your iPhone with you when you're in the toilet, right? Remember to take picture. Yes, absolutely. Because the stool is going to tell you a lot about your health. The stool is going to tell you a lot about your health. And maybe if you study and analyze enough, after today's lesson, you may not need to see Dr. Gwee anymore, because you become an expert in poo. Okay, now I want to just let these two gentlemen go, and then we'll now proceed with the next part of our talk show tonight. Is that okay? Can we give these two gentlemen, before you go, I have a present for you. I have wait. I have something else for you. Yes. This is in appreciation for your, participation. For you guys who may be struggling with constipation, especially you, every month you got pain, right? This is good for you. It's fiber, okay? And this one for you. Okay, thank you so much. Come, take a seat. Now let's turn to our expert here. Dr. Gwee, can you tell me, before we talk about all this poo-poo stuff, tell me why are you so interested in poo business? Oh, you have a mic.
Very, very good question. I think even before getting interested in poo, my main interest was in food. And as you said, food leads to waste, and so it's all connected. My ambition from the beginning was to help people enjoy the food and not be too bothered about the discomfort that they feel. Give them the right knowledge to know how to eat, how to eat what they enjoy without suffering for it.
So that's the reason why you want to be an expert in poo, because you want to help people, to enjoy their food, right? Not just in consumption, but in passing out as well, right? Am I right? So, Dr. Gwee, can you tell me about this thing called what, the Bristol stool chart? Did I pronounce correctly the name?
Yes, you did. Now, I think you have to leave it or trust the English, the British, to go into this type of detailed study. What they did was, in this city of Bristol in the UK, got patients and healthy volunteers to collect their stools in a plastic bag and then bring it to the hospital. I was involved in a similar kind of research. I can tell you I had a whole freezer full of poo. When you open it, it's worse than durian.
Wow.
Yep. And I don't know whether we've ever cleared it, because nobody wants to clear that mess. So what we do is we take this poo and then we take pictures of it, and we will also analyze the stool to try and measure how long it took from mouth to anus for each type of this stool form. So like at the top, the little nuts that you see, those are the slowest ones. Those took at least 72 hours or maybe even longer to go through the system. Whereas at the bottom, the watery stool, it could be 12 hours, it could be 6 hours, and it's out of your system. The ideal is number 4, the sausage smooth shape. That will be about 24 to 48 hours.
So, this chart came about from all the research, am I right?
Yes.
And based on this chart, you think that type 4 is the ideal. But can I ask the audience, how many of you has type 4 stool? Put up your hand. Too shy. Only the gentleman here. Wow.
Yeah.
And you,
Those two are your plants.
only 2% have a, what they call type 4, normal stool. What about type 1 and 2? When people have type 1 and 2, what happened to them? Why do they produce this kind of funny stool? They even call that what? P is like hard as P. Yeah?
The type 1 and 2 stools typically represent the people who suffer with constipation. So really, at the end of the day, constipation means that it took a long time for that stuff to get out. It's staying in there a long time, so it got dehydrated and you're left with these very dry bits. Whereas the faster something goes through your system, the wetter it stays. Because all the fluid you drink will rush out with it and keep it moist and hydrated. Whereas something that stays in your small intestine for a long time, all the moisture gets absorbed, and then all you do is simply pee it out.
So the reason why people get type 1 and type 2 is because, according to Dr. Gwee, because of dehydration.
Sorry, not just dehydration, but rather that person's colon and even the small intestines are slow in their movement. It takes a longer time to go through. So this is really to help people understand constipation as a problem of slow transit through the intestine. It takes a long time to go through.
So it's because of two things, dehydration and the slowness of the intestine. Am I right? And what can we do about it? And why is it that some people, the intestine seem to be slower? Is there something wrong with them? Or is it a lack of sleep, lack of exercise, or is it stress?
It's multiple factors, but I would just want to, because I observe a very interesting phenomenon. In your audience, it's largely ladies. Right? The guys are the ones that I think are the ones who have the normal poo. And that's why two of them put up their hands. Okay.
So you're
Now,
saying that the ladies have abnormal poo?
they
Is
didn't
it
put
true or
up
not?
they didn't put up their hands, right?
Oh,
Okay, but it is a statistical fact. And when we've done research, that more women suffer with constipation, especially those in the age group 20 to about 40. Okay, so women are the unfortunate ones who suffer with constipation. Partly, maybe you're right. You remember you mentioned how the women's intestines are actually longer than the men's. So that could be one factor. But their transit time takes longer. It takes longer for something to move through a lady's intestine than men's.
so ladies tend to do their business more slowly. Is that that's what I get the message? Am I right? And so they suffer more, right? So poor ladies, they get cramp every month. They also get abdominal pain from this constipation, the stools. Poor thing. How about
Men also suffer.
men also suffer? Yeah, actually, I do suffer.
I tell you why. Because I have couples coming to me. Okay, so the lady is the one with the constipation. Then the guy, the wife will turn around. Oh yeah, this guy after every meal is rushing to the toilet. So that's the other type of irritable bowel where after each meal, urgently they must rush to the toilet. So the men tend to get diarrhea. The women tend to get constipation.
So the men get diarrhea. So men, actually, you are getting what, type 7?
6.
6 or 7, right? Why is it like this? Is it because their intestine is shorter, or is it because they go outside and work, they anyhow eat, So anyhow pass.
Yes. I think you've hit a very important point. This is a little bit politically incorrect, but I think that's the kind of
Politically incorrect.
That's the kind of environment we want to
What has
create.
poo got to do with politics anyway?
Poo has to do with everything in life, but never mind. That's another issue. Okay, men, we don't care what we eat. We eat whatever rubbish, unhealthy, and I can tell you we have no problems with bowel movements. Women are the ones who are very health conscious. They drink lots of water, they bring bottles of water everywhere, they'll take all that grass, all that fiber, but they're the ones suffering with constipation. So you got a point there.
So men, why you have all this loose stool and always cramp, rushing to the toilet, and some men, they think that God is in the toilet,
The politically incorrect part is that we're always encouraging people to eat more fiber, more vegetable, more fruits, right? But the truth is, when it comes to severe chronic constipation, fiber has nothing to do with it.
So what you're saying is something new again. You're saying that for severe constipation, fiber is not helping. Why is that so?
Because the problem is not the diet, the problem is that the intestines are slow. So imagine if you've got a drain, and it's already all blocked up with all the stools that you didn't pass, and you try to eat more fiber, you're just forcing more hair down the drain, just getting choked up and getting really bloated.
So if you have type 1 and type 2, right? The issue here is you are having constipation. Don't rush to one of the pharmacy and buy one of those fiber because it may make it worse. Am I right?
Those fibers are generally better tolerated because they gel. And then if you think about it, those jelly can stick all those little balls into a nice tube for you. But it's the rough fish, it's the raw vegetables. And actually, to me, my observation is cereals are the worst. Those whole grains and all those are very difficult to digest and create a lot of bloating.
So for those who type 1 and type 2, so they will go through painful episode when they go to the toilet, right? And because these are rough and hard, and they even get bleeding, am I right? Anal bleeding, will pass it out. And whereas those in type 7 are those who are very kanchiong. They run to the toilet, God, are you still inside there? That's why to men, God is in the toilet. Because every morning he's always asking the question, God, are you still inside there? Why it takes so long? Because cramp, Because men eat dirty stuff, right? And then that's why we get all this problem. So those who are in type 4 and 5, is there any way for people like those ladies who are in type 1 and 2 to get to type 4? How can they improve,
Yeah, type 4 is the nirvana of stool.
Nirvana, okay.
So women want to get to 4 from type 1, men will get to 4 from type 7.
Okay.
But I think you got a good point there. You hit the right word, the anxiety. Actually, part of the thing that causes diarrhea is anxiety. So there is some element of that. Okay, but back to your question about how do women achieve type 4 is how can they accelerate their intestinal transit? How to make it faster?
Yeah,
so
how do they do that?
Maybe we give them anxiety, they'll be faster, right? Okay, but seriously speaking, this is where it becomes even more politically incorrect. The kind of foods that stimulate your intestine to move faster they are not your healthy foods. They are all your unhealthy foods. And that's why I think men are more prone, because we eat all the unhealthy stuff, we don't care.
So you're
You
saying
see?
women should eat more unhealthy stuff? I mean,
That's
that's what you're saying, right?
That's
Politically?
right. Incorrect.
Huh? Now I'm wrong.
It's politically incorrect, but it's scientifically correct.
Okay. He's a bit confused. He mixes up science with politics. So sometimes I'm not sure whether politicians are speaking the truth or not. And sometimes I'm confused whether doctors are trying to be politically correct
No,
to
no,
patients.
scientists are the ones who have the final answer. But okay, I tell you why. Because to move your intestine, you need a stimulus. The food that you eat needs to stimulate it to move. And in scientific research, only 2 specific food chemicals stimulate the intestine to move. One is oil. Something oily stimulates the bowel to move. So you wake up early in the morning, you eat your plate of char kway teow, chai tow kueh, you get go. Yeah, you eat all this kind of dried rabbit food, it just gets stuck there, dries up everything, desiccates. That's what you get.
So what
Okay,
you're saying,
but
what
not only
you're
that,
saying is that skinny ladies who maintain their weight well actually are suffering in pain. Is that what you're saying? Whereas those ladies who doesn't care about their weight, they eat char kway teow, are having a good time in the toilet.
Well, wait aside, but okay, the best example, you look at the animal kingdom.
Now we
Okay.
talk about animal
Yes,
kingdom.
because
Are we?
Because this is science, this is biology. Look at all those herbivorous animals.
Wait,
the
you're
rabbits,
using a very expensive term.
the,
High-powered. What's
the, the,
herbivorous?
the rabbits and the goats, so eat only plant foods,
Okay.
right? Look at the kind of poo they produce, those up there, right?
No. As far as I know cow also eat plants and all that.
Yeah,
but look at the poo.
but
they
cows,
produce the other
cows
type.
get the other end, exactly. They
Yeah.
don't produce number 4.
No, yeah, I know,
I know.
but why is it that the same animals, right? They eat vegetable, right? And one group produce pellet on type 1, another group like cow produce the mushy stuff, that you step on it.
Cows have got a certain kind of special thing which is called this 4-chamber stomach rumen. So it spends a longer time there. And then they have certain build-up of certain bacteria that causes a lot of fermentation. And cows are the biggest gas-producing animals. Okay, so in fact, there's a term called cow fart units.
Cow fat unit.
They are the greatest contributor to greenhouse gas.
So you mentioned something that bacteria does play a part in whether you produce type 7 or not. Does it mean that the people with type 1 and type 2 actually do not have enough bacteria in their intestine?
I think now we're settling down to the nub of the problem. Now, you were talking about how much poo weighs and all that kind of stuff. Now, when you take poo, anyone's stool, scientists have analyzed that. Okay, they measure the dry weight. That means you take out all the water. How much of the dry weight is made up of fiber? Okay, it's 15%, 1-5. Then how much of the dry weight is made up of bacteria? It's 55%. So what will influence your stool more, bacteria or fiber?
Bacteria, that's right. So are you saying that ladies, you should start eating more bacteria?
So, I mean, one of the theories is that
other
maybe
than oil, you also mentioned oil just now.
women are more prone to constipation because they've been too clean.
Too clean. Okay, so ladies, when you go to the hawker center next time, I suggest you skip the grade A, grade B, look for the grade D and E. Then you find going to the toilet will be a very nice experience. Am I right? And then you should visit the char kway teow store. But I think the health science, the health promotion board won't be very happy with what you say.
Absolutely.
Huh? Is that why you talk about politics?
Yes.
So can I ask a bit more personal question? Do you eat a lot of char kway teow?
Not particularly, but I have no inhibitions about what is healthy, what's unhealthy.
You have no inhibition, and you are talking like as a doctor.
No, because I know the real science, not the hype.
Okay, he knows the real stuff, not what was projected to us, politically correct on media. So what is the real stuff?
The real stuff is you really got to know your own system. What type are you?
But how is a layman going to know what type they are?
Okay,
And what's
as
the
I
real
said already,
system?
first, if you're a young lady, you tend to have slower kind of bowels. Number 2 is you look at the stool chart. So every morning, take a picture of it. There's actually an app called for the Bristol stool scale where you can actually record it.
Go and download the app, okay?
Okay. Then you can tell whether you are slow or you're fast.
And download the app and take a record of all your stool and start to share on Facebook.
You will see certain interesting patterns. Okay, maybe this will bring another perspective to why men tend to be fast, women tend to be slow. Why men are from Mars and women are from Venus? That kind of concept. It may be partly hormonal. I think when many women, if you sit down and think about it, they do tell me that premenstrual, they get harder stools, they get constipated, they get more bloated. Once the menses start, they tend to get loose stool and diarrhea.
So it's also related to the hormone. So therefore, does hormone therefore play a part in how fast the intestine move?
To some extent.
And that's
So there's
something that men can't do much about,
so
right?
there's food, there's anxiety, there's hormones, so it's multifactorial.
How about exercise? Can women do more running to speed up the intestine?
The impact of exercise is minimal. Just as the impact of fiber, in my opinion, is minimal. It does contribute, but in really stimulating it in a fast way or slowing it down in a calmer way, minimal. Exercise, I think, helps partly to relax the person. Okay, but keep in mind, you also get dehydrated.
So exercise don't really help in moving your intestine. And you just said something very politically incorrect. Because as doctors, we are supposed to promote exercise. And here we are now in a very controversial topic about, in order for you to have a nice experience, you should not, don't bother to exercise so much. Eat more oil. You get called up by medical counselor, I'm telling you that. And you know that this is going on live on.
I have no worries because I have the science behind it.
Okay, he has the science behind it. Okay. Now you know why he's an expert and why he won a research award for, in Rome. He has a science. So, ladies and gentlemen, today this is really a sneak preview of the real stuff that you don't get it on TV, okay, or newspaper, because those are, can I say, not the real science? This is the real science. Oh. Let's go on to, how about type 5? You hardly talk about type 5 and type 3. What happened to those people?
That one is a bit of a perceptive issue. Okay, so some people will even feel that type 3 is a bit difficult for them. But to me, constipation, difficulty is in the eye or in the anus of the beholder, right? No, that means if you feel that type 3 is dry, it's difficult to expel, then it's your right to say that because it's you are the one who's experiencing and suffering it. Then my job is to see how I can help you to expel it more efficiently.
And how about type 6 then?
Type 6 is loose. So it's fast, and then you tend to get oily stuff coming out with it.
Oily stuff. Okay. Are there anything else besides this about poo that is not captured in this chart? Because I know some people actually pass out black stool. What happens if somebody passes out black stool?
I think this brings to a very serious, more medically important issue of the color of the stool. People ask me all sorts of colors. They say, does it matter it's green or very dark brown? Actually, finally, most of the time, only 2 and maybe sometimes 3 colors matter. Number 1 is black. Number 2 is red. Black, as Dr. Low is trying to tell you, indicates internal bleeding from the stomach, from the upper part. So that's serious. So whenever you see something black, go and rush to see your doctor right away.
Do they get black because they take a lot of iron or because they take a lot of liver?
Yes. Part of it is from the iron. So certainly, if you take charcoal also, you will see it black. But it's not going to be what we call tarry black, a shiny kind of black, okay, and very kind of sticky, and there's a certain smell which Dr. Low is familiar with.
Is there a word for this kind of stool?
We call it tarry stool or melina.
Melina, it sounds very nice. So ladies, gentlemen, don't ever call your children melina. It sounds very sweet, but it actually means black tarry stool. Okay? And black tarry stool is actually come about because of internal bleeding inside the intestine. Am I right? How about the other kind of stool that you are talking about? You're saying the other colors.
Red will be bleeding. So if there's blood, take it seriously. Don't just blame it on piles because, most people will have piles. So just because you have bleeding and you have piles, you cannot be sure that it is due to the piles. You can always have another problem above it that's causing the bleeding.
So what you're saying is that if a person has blood in the stool, right, red color, you cannot assume that it's due to piles, right? And so what do? They have to go and see a doctor.
Just go and see your doctor.
How is the doctor going to differentiate whether this is bleeding from the anus being torn because you have hard stool, or is it piles or something else more sinister?
So the doctor will help you to analyze it. So for example, if it's a tear, you will usually experience a sharp pain, very localized to one part of the anus. And he can also examine that and actually see the tear and maybe even see blood coming from it. And that way he can verify it for you. That's what we call an anal fissure. Okay. On the other hand, if it's blood kind of mixed in with the stool and there's a bit of mucus, then it usually signifies some inflammation in the large intestine higher up. And then he may be able to examine you and find that there's some parts of your abdomen that's painful or tender, and from there get some confirmation that there's inflammation or infection inside your intestine.
So what you're saying is that if you have bleeding, you must see a doctor, and the doctor will examine you to exclude, to make sure you're not suffering from anal tear, or we call that anal fissure, or piles, or something else more sinister. And one of the signs about something else more sinister could be mucus in your stool, right? Am I right? Mucus in your stool.
Yes.
So if you pass up mucus in the stool, it's one of the dangerous signs. You must see a doctor. And if you go and see a typical GP, what can the GP do other than the physical examination? Can they do a blood test or stool test?
I mean, they'll send you for blood tests, which can show up infection or show up that you've lost a lot of blood. They can send your stool sample, which may show certain parasites or certain infection. And there are also tests now where you can send to look for inflammation beyond just seeing blood in the stool.
So there are tests that the doctor do, and at which point can a so-called doctor, a GP, refer, a patient to someone like you? Do you do colonoscopy?
Yes, I do. So the experienced GP, if you've seen your doctor for all your life, the moment you walk in when you're not well, when something's amiss, he can tell it straight away, even without a test. So those can send you right off to the specialist. The others who are not so familiar with you, they spend some time understanding your problem. They can also get a good, reasonable diagnosis. And if they're still not sure, they send for tests, and the tests show up something as an alert, then they will send you to the specialist.
So the take-home message is to be faithful to your general practitioner, your family doctor. Don't be promiscuous with your doctor. Got the message? Don't doctor hop. Because if you doctor hop, the doctor may not know you. Then they may miss something sinister. So stay faithful to a family doctor like myself. Don't run away, because if you stay faithful to me, I'll know you inside out, literally. And if I don't know you inside out well enough, I will send to him, a guy like him. And you know what he's going to do to you? He's going to pass a little camera. Singaporeans love to do selfie. Singaporeans, colon cancer is probably the top cancer in Singapore, am I right? The number one cancer. And yet, it should not be missed. Yet there are people who die of colon cancer. So, at which point in our life should we go for a colonoscopy? Colonoscopy. Colonoscopy means, scope means a camera. Colon, pass a scope to a camera. That procedure is called colonoscopy. So, Dr. Gwee is an expert in that. He will help you to do a selfie of your inside. Okay? And maybe he will just describe to you the procedure now.
It's a selfie with a stick.
The stick. Okay, this is a selfie of a stick. Okay.
Okay. Actually, you brought a very important point, because while colon cancer is so prevalent and the major cancer, it's actually so preventable. People don't have to get colon cancer. People don't have to die from colon cancer. It's preventable. It's preventable because we know they start off as polyps in the colon, which can be seen with the colonoscopy. So when we put that camera in there, it's quite easy to spot a polyp. Even as small as 1 to 2 millimeters, we can see it. And with the colonoscopy in the colon, with the polyp in our side, we can just put in that forceps, that metal thing there, and bite that thing, burn it, and take it out. And we've cured you of that polyp. It's gone, it's taken out. It will not have any more chance to grow. And then if you do have polyps, we can then alert you that you have risk of future problems with colon cancer. That means Once a person has polyp, then it raises the question that this person's colon has that predisposition. So they may grow new polyps in the future. Then we could recommend that you do it again in 3 years or 5 years or 2 years or 1 year, depending on how big the polyps are, how many polyps there are. On the other hand, if you have no risk factors, we usually no risk factors meaning nobody in your family has cancer, you have no medical condition like ulcerative colitis or Crohn's disease, which is your next topic, that will predispose you to cancer, then you just need to do it once when you're 50 years old. And if you don't have a single polyp, you can close your eyes for the next 10 years.
How many of you have done a colonoscopy? Put up your hand. Was it a frightening experience? Scary, lady. Why is it so scary? I thought you slipped through the whole process. No? You didn't slip through the whole process. From what I know, we are supposed to slip through the whole process. Why are they saying that they're not slipping?
Yes, I think the experience is a bit variable. If you've done it 10 years ago, certainly it's not going to be as comfortable as if you just did it recently, because the technology has improved, the sedating drugs have improved. But sometimes it all really depends on the facilities as well. If it's a very busy center, they cannot have everyone sedated and have so many people to monitor you, because sedation has some safety concerns that you need to watch these people very closely. So there are variation in the level of sedation that you might get.
So one of the things you have to do before a colonoscopy is that actually a surgeon will let you drink something and ask you to prepare your bowel, tell you what not to eat before few days before the procedure, and finally on the day itself or even the night before, you're supposed to drink a fluid, and after that you are going to purge like crazy. And this was the thing that scared me the most when I went for my colonoscopy, because even as a doctor I have fear too. I'm a human being too. I also have my doubt, even though medically, scientifically I know all the objective stuff, but when it comes to your own, it's very different. But it's not as bad as we imagine or I imagine. Actually, it's not an unpleasant experience. Not like you're going to get cramp, running to the toilet all the time. Because when you say you go toilet all the time, you think you got diarrhea pain, cramp. No, it's actually not that bad. You just have to make sure you drink a lot of water. And after the whole procedure, you actually have your whole colon washed out completely. And I know ladies like to go for what called detox. Okay, you actually have a thorough cleansing of your whole colon after the whole process. And then our Dr. Gwee will put a camera in, and then you take all the nice video, and then you can add on to your Facebook collection. Selfie of my intestine with the colonoscopy stick, cell stick, right? So if you are more than 50 years old, you should go for a colonoscopy, because you should not die from colon cancer. It will be a shame if you die from colon cancer. So this is something that we can, do for ourselves and for our loved one. It's something that we can do to take care of health, because medical science is so advanced now. Okay, and yet there are still people who die from this. It's quite sad. You know that last time Superman fly with a hand in the back and one hand in front, and now Superman fly with both hands in front. Do you know why? Last time Superman fly with manual gear, and now Superman fly with two hands in front, auto. Medical science has gone so advanced. We are gone auto mode. Yet our knowledge, our understanding among the public, patients have not caught up. We're still in manual mode. We're still doing all the funny things that are not scientific. And then sometimes even the media are projecting wrong messages. That's why Dr. Gwee here is giving us really scientific stuff, although sometimes not politically correct. Okay, but it's definitely good for your health. Okay, we are going to now go on to the main topics of today's talk show, which is the irritable bowel syndrome. Okay, what is irritable bowel syndrome, Dr. Gwee? You are an expert in this, and you even won an award. You are one of the committee who set all the standard in Rome. Am I right?
Yes. I think at the beginning you mentioned about having abdominal pain. That is often considered one of the key symptoms of irritable bowel syndrome. But I want to just also highlight that many of these people who suffer with irritable bowel actually do not experience pain. They may just experience bloating. So bloating can also be a very common symptom or experience in IBS patients. Okay? Essentially what it means is that when
IBS means
Irritable Bowel
syndrome. Okay,
Syndrome.
just for short, easier to
Yeah.
pronounce.
So what irritable bowel means is that if your colon is indeed healthy, there's no cancer, there's no ulcer, there's no inflammation, there's no infection, and yet when there is pressure inside the colon, you experience discomfort, be it pain, bloating, or just some vague discomfort. In fact, many patients actually mistake irritable bowel for gastric. Some of them even experience what they think is a gastric pain, but it's really part of irritable bowel. I think Dr. Low showed a very important picture of the whole colon. And you remember how long the small intestine and the colon are. The small intestine, he said, was 6 meters. The colon is 1.5 meters. Altogether, 7 to about 8 meters long.
Yeah.
All crowded inside your abdomen. Okay? The stomach is only a small bag there. So there's a higher chance that pain is coming from the intestines, be it small or large, than from the stomach. And not only that, that part of the colon, the transverse colon, the one that stretches across, is actually overrides the front of the stomach. So if imagine you got gas there, it may make you feel bloated, make you think that you've got a indigestion, gastric stomach problem, when in fact it's irritable bowel or it's due to your bowel problem. How you can tell whether this bloating, gas, discomfort, indigestion is coming from the colon or the bowel is you ask yourself, when you have this sensation, if you pass motion or you pass gas, do you feel a reduction of the discomfort? Do you feel a relief? Then you need to pay attention on your poo. Yeah, a lot of people don't. They just take it for granted that I eat, it comes out. And they don't see that there's a certain shift in the pattern of their bowel in conjunction with their bloating, with their gastric, with their pain. So if you see that your stools tend to be getting towards from type 4 to type 5 to type 6, the more bloated, the more discomfort you get, that's also a sign of irritable bowel. If you're going more frequently, okay, you usually go once a day, and then now with the discomfort, you're going extra time in the afternoon or even at one more time at night, and when you go, you feel a sense of relief. That's irritable bowel. That's what we call the irritable bowel with diarrhea type. It doesn't have to be severe diarrhea, it doesn't have to be type 7 or watery. It can be type 6, can be type 5 even. On the other hand, there's the other form of irritable bowel that affects women more, irritable bowel with constipation. Those patients will tend to feel discomfort, bloating, even cramps when they haven't managed to clear the bowels properly. When they find that their stools are shifting towards type 2 and 1. When they find that they're going less and less frequently. When they feel that they have not been able to clear the bowels completely. Sometimes they are going, but it's not complete. They get a sense even after they've got up from the toilet bowl that something is still there, but they just can't push it out. And sometimes it creates a bit of confusion. Sometimes because they can't clear completely, they will go multiple times to try and clear it. So in the end, when they count, it's like, I'm going 3 or 4 times. And if you don't tell, or you don't look at your stool and tell your doctor that they are type 1 and 2, you tell the doctor, I'm going 3 to 4 times, the doctor may be misled to think that you're suffering diarrhea.
So, one take-home message is to take pictures of your stool. And how do you choose a good doctor? It's a doctor who is interested in the selfie of your stool. Okay? Otherwise, you may be seeing the wrong doctor. And he may think that you're actually having gastric pain. When in fact, it's because of the colon. The transverse colon stretches just below the stomach. And Dr. Gwee said that one way to know whether it's due to stomach or not is when you pass flatus. And if you get relief, then you know it's probably from the intestine, not the stomach. Am I right, Dr. Gwee?
Yes.
So how often do people, I know, how frequent are they, what's the frequency of
IBS.
IBS, yeah,
Yes.
the frequency, the incidence of it?
The prevalence in Singapore is estimated to be about 10%. That means, 1 in 10. So with a population of 5 million,
Yep.
you're looking at 500,000.
500,000 people with IBS. Now you know why the Maui specialists are doing so well.
Glen
Yeah.
Eagles Hospital, sorry.
Gleneagles.
Yeah.
Gleneagles specialists. the private specialist.
No,
in general.
it's like everybody thinks probiotic is Yakult.
Okay.
Yeah, but actually, no, it's important. I think not all probiotics are the same, and you do need to learn how to differentiate them.
Okay. So there are a lot of people who suffer from IBS. So if you feel that you are having bloatedness, pain, you could be having IBS. That's why you are here today. So is it true that people get IBS because they got bad genes?
There is some research suggesting there's a bit of genetic component, but anything that's so common, 10% of the population, it's very hard to imagine genes playing such a dominant part because it's so common. Not only that, there was also a research where they actually looked at annually how many people get irritable bowel and how many people lose irritable bowel.
So
and
people
they found
can lose irritable bowel.
yes,
okay.
they can. So you can lose your irritable bowel. Don't be disheartened. It can be managed to a stage where you forget you ever had irritable bowel. Okay, but there's a 10% turnover rate. So they estimated that at 10% turnover rate, after 10 years, everybody in the population would have suffered IBS at some time in their lives. So not only the people who suffer IBS are the ones, you may be at risk as well.
So if you are suffering from IBS, don't get discouraged. You may get out of IBS one day. Okay? There are 500,000 people in Singapore with IBS, and 500,000 people who got IBS, where the first 500,000 may get better. It just continue. So today's message about IBS is useful because there are many things you can learn about IBS. And one of the things I want to ask Dr. Gwee now is, do people get IBS just after, let's say, a bout of, say, food poisoning? Is it true that you had IBS suddenly coming into your life after a bout of terrible diarrhea, food poisoning?
Yeah, I think he knows because I did the research on what we call post-infectious irritable bowel. So in fact, this is probably the best recognized cause of IBS. Not that it's the only one and not the major one, but it's the easiest to study. So what I did was I looked at patients who came in the hospital with food poisoning or what we call acute gastroenteritis. They ate something and then they started getting diarrhea, fever, vomiting. And we followed them up after they recovered from the food poisoning. And then we found that a certain percentage of them got IBS. Now, what that percentage is depends on a few factors. Depends on the severity of the infection. The more severe the infection, that means it took longer to recover from the infection, then the higher the chance of getting IBS, irritable bowel. There were other factors that we also observed seem to predispose to people getting IBS after an infection. We found that stress and anxiety in that person during the IBS, during the food poisoning episode, also seem to be a risk for getting irritable bowel. It may be that the stress affected their immune system so that their response to the food poisoning wasn't as efficient in overcoming it as the person without stress.
So the take-home message here is, if we are going to have food poisoning, don't be so stressed lah. Go for a nice movie, go for a walk, enjoy life a bit. Because otherwise you may end up with IBS. And then you end up with a lot of pain in the future. So take it easy when you have food poisoning, knowing that you get better. Just drink a lot of water, take a couple of days of MC. Your bosses won't be very happy, but at least you will be happy.
Actually, there's another possible contributing factor, although it wasn't a very strong point, but we also do observe that people or patients who take antibiotics could be at increased chance of getting IBS.
Why is that so?
Even those people who have food poisoning, it seemed like those who have antibiotics may be at greater chance. But in the food poisoning case, it may be because these are the people with the more severe food poisoning, we had to give them antibiotics. But we also have observations in a broader group of patients who don't have food poisoning, who are taking antibiotics for other reasons, who seem to be at risk of getting IBS. This brings us to the gut flora or microflora, we call it. That means all these bacteria, these millions and billions of bacteria in your intestines. Dr. Low mentioned that you've got more bacteria in your mouth than the rest of your body, but actually we have more bacteria in our intestines, 10 times more bacteria in our intestines than all our own body cells.
So you are saying that if you take antibiotic, you are putting yourself at higher risk of getting IBS. Am I right? Especially more so during the course of when you're having a food poisoning. So, ladies and gentlemen, if you are sick, okay, don't go and see your doctor and ask for antibiotics. You're not doing yourself a favor because you are going to wipe out a lot of what we call the good bacteria. Can you see the chart there on the?
Maybe we should qualify. When you are not that sick, mild food poisoning, yeah, you can treat yourself. But if you really do have bad food poisoning where you're dehydrated and you've got fever, do see the doctor, listen to the doctor. It tells you need antibiotics, you need antibiotics. But if it's just a bit of like you ate something wrong, then you get diarrhea, don't go and rush to take antibiotics. This is where now we think probiotics are coming to the fore, being maybe a more balanced and healthy way of managing these milder episodes.
So don't try to be your own doctor and ask for antibiotics. If you're not well, the doctor can prescribe, but don't ask for what we call social antibiotic. Some people think that antibiotic is the cure-all for everything. And what is antibiotic and what is probiotic? It sounds the same. What is the difference? Are they the same thing?
No. So bio refers to the bacteria, right? Because bio refers to life. Anti means against, right? Pro means for, right? Yeah, so you can tell the difference. So the probiotics are the so-called bacteria that's supposed to support your health and confers benefit to your health. Okay, whereas the antibiotics are to get rid of the harmful bacteria.
So where can we get good bacteria? How can we get more good bacteria into our system? Can we drink more Yakult, yogurt? Or is there better things that we can take? Or should we go and see a doctor just and ask for probiotic all the time?
Yeah, okay. There are many different strains of bacteria that can be suggested as probiotics. Okay, it's not one special formula. Is that every probiotic is the same. Okay, so it's very difficult to know which probiotic works for which person because it's a very individual thing. In fact, it may even now they've got this thing called enterotype. That means instead of blood grouping, you can type the person according to that combination of bacteria that they have in their pool. It's like a unique fingerprinting even. But they have been able to produce 3 enterotypes, I think, just as 3 blood groups of whatever number of blood groups you have. See? So the skill of trying to see which probiotic to match with which individual suffering which condition, that's a major challenge. Okay? But for people who are well in general, without any digestive problem, without any health issues, you get probiotics from fermented foods. So you get probiotics from yogurts, right? You can get probiotics from fermented milk drinks. Some people say even from kimchi, all these various,
Kimchi helps,
yeah. So, but that's provided you're well. And then this is just like a maintenance. Okay, in those situations, my general feeling is go for the food product that contains probiotic rather than take a capsule or a medication. But when you're not well, then you need to talk to your doctor and tell the doctor what you're feeling. Then he can match it. Like you've just heard you've got irritable bowel with constipation. You've got irritable bowel with diarrhea. It can't be that the same treatment works for both, right? Anti-diarrhea will be for the diarrhea and laxatives will be the constipated people. So matching it is a challenge, even now it's a skill. So the way that scientists go about it is that we look at what we call clinical trials. That means they've done studies in this specific condition. So they've done studies in irritable bowel with this product, and then they've proved statistically that it works better than placebo. At least you've got that level of testing. Those that you get over the counter, off the shelf from your health food stores, they've actually never been tested or for a specific condition. I always say all the investment is in marketing, putting up nice shop front, labeling that big bottle, instead of investing it in scientific research to understand that person's IBS, that person's constipation, the person's diarrhea.
So what you're saying is that all these probiotic out there that you can buy off the shelf may not work for you. They are just pushed to all of us because of advertising, marketing, dollars. So you should see a doctor who can prescribe the appropriate probiotics for you. Personally, do you think that a normal person like myself should take probiotic as a supplement?
I don't know how normal you are.
I have type 4.
Okay. At least from the bowel point, you're normal.
Yeah, so therefore, should I therefore take probiotics, you know?
I don't see a need to.
You don't see?
personally, yeah.
But I
at
understand.
least in terms of poo production.
So you don't think I should take a probiotic? What if I'm a type 6 or type, say, 1 or 2? Should I be taking probiotics?
Yes, then if you're feeling uncomfortable with those stools, then do, because it may make you feel significantly better. I mean, I think, so what if you get type 1, so what if you get type 6 or 7? The point is whether you're uncomfortable in that situation. If you get a lot of gas, if you can't clear it properly, then you're not getting the quality of life that you should get. People who are constipated, I can tell you, they tend to have reduced kind of outlook on life, reduced appetite, because everything is stuck there. You just don't feel like eating anymore. But if you can clear well and get good feeling in your stomach, and then you can go out there and enjoy yourself, why don't you do it?
The key to a good, happy, healthy life is if you are Teochew, you know what I'm talking about. For the sake of the non-Chinese Teochew, you want to be healthy and have a happy life, you must be able to eat, you must be able to poo, and you must be able to sleep. Right? Try having this problem of being unable to poo. You know how miserable life is. You can go to the nicest restaurant, but really you cannot eat anything in. And if nothing go in, nothing will come out. Nothing go out, nothing can go in also. So remember, basic fine point about life is just you'll be a blessed person. Okay? Remember that. So what you're saying is that a normal guy like me, type 4, don't need probiotic. What if I still very kiasu, I still want to take, then will that cause more harm to me?
There'll be no serious major side effects on taking probiotics. It's just that how do you make something good better, right? Okay, now sometimes...
No, I mean, would the probiotic help to wipe out my bad bacteria in the system so I therefore get less episode of food poisoning, for example?
Sometimes I myself personally practice it, but I will also
but you practice something different that you...
suggest to some of my patients when they're traveling, especially to less developed countries, that it could be useful to just prophylactically, that means even without problems, take the probiotic as a preventive measure. There is some evidence that it can reduce the risk of you getting traveler's diarrhea. So that could be one context.
So if you're traveling to third world country, other than observing good personal hygiene, drinking clean water, remember, maybe you will help to take some probiotic to be a little bit more kiasu. No harm, right?
No harm. Maybe not, you don't even have to go to third world country. Here in Singapore, if you're eating raw food, it might still be a good precaution.
Sushi, salmon,
yes,
all the
salad.
Okay, so you have to take probiotics. So before you eat your salad, take the probiotic. Don't put your pepper and salt, put probiotics. That's what you're saying, right? So we should suggest for the restaurant to have this probiotic shaker, right? Add a bit of probiotics. Is that what you're saying? Be politically correct.
No, I think it depends on the person. I mean, okay, look, if you're constipated, maybe getting a bit of diarrhea will be good for you, right? Because it will stimulate your gut bacteria and
now
move it
he's
the
saying
other.
that a bit of gut bacteria is good for you as well. You know, if you're constipated, you get a bit of loose too, right? But if you go to the extreme, then you'll be screaming, God, why are you still inside? Okay. For people with IBS, one of the things you talk about is stress, for example. Does it mean that we should go and see a psychiatrist if you got IBS? Because a lot of people think that IBS, you got IBS, your gut is irritable, meaning that you're a very irritable person. Therefore, you're very stressed, you should go and see a psychiatrist. Is it true? Does it help to see a psychiatrist? There are no psychiatrists here, am I right here?
I know that there are doctors and there are specialists also who believe that IBS is a psychological problem, but I don't agree with them. Okay, IBS is so common, okay? It's only a small percentage of IBS patients, the really extreme, severe, hardcore ones, who have got significant psychological problems. The broad group of the milder, the ones that we all see in our clinics, they don't have major psychological problems. So to send them to see a psychiatrist is unfair. Because I think they do have important disturbance of what we call their physiological functions. That means the way the intestines work to process food, as with everybody. Guys just tend to be fast, women just tend to be on the slow side. But it doesn't mean that they're abnormal. They're still within that normal span of life processes. But it's just that sometimes you don't cope so well with it. Maybe because you're undergoing a little bit of stress, a bit of anxiety. I think something that you brought up, which I want to just expand on, is sleep. Sleep really is very important. In fact, not sleeping well one night, the next day your bowels can be more sensitive in some people. Not sleeping well one night, the next day your bowels may not clear the bowels so well as well. So sleep is something that tends to be under-evaluated in a medical kind of setting, and actually it's so important. I mean, now we got all this 24/7 type of jobs that people do, right? So you can imagine more problems will be surfacing.
So instead of spending your money visiting a psychiatrist and thinking you got psychiatric problems, psychological problem, just spend more time, sleeping on your bed and drinking slightly more water, right?
No.
No?
Water, you wake up the whole night to pee. No, that's why I think water.
How about those people who get constipation?
Water does not work for constipation. When the constipated people really constipated, they have slow transit. Okay, that means when you drink water, the water stays in the intestine, it gets absorbed. You are just going to end up peeing more. That's why when you went for your colonoscopy, was it only plain water you're drinking? No, right? They'll add some salt to it, they add some powder, because you need these salts and powder to hold the water in the intestine to hydrate the stool. If you just depend on plain water alone, it will not work. You will just pee more. So it disturbs your sleep. Okay? But I should tell you something very interesting recently they found. They found that probiotics may actually improve the patient's sleep and mood even.
Wow. Where's the drug companies? Your sales going to shoot to the sky. You want to have a good sleep, sound sleep, probiotics. Is that a correct message to tell the world?
Not prime time, not prime time, not prime time yet.
Not prime time yet,
but
okay.
in the realm of science, yes.
Why is that so actually? I mean, it's just good bacteria. Why does it help?
We have not fully appreciated how much the bacteria in our intestines actually impacts on our overall well-being. I mean, we talk about heating and cooling. How do we know it's actually not driven by our bacteria? Maybe when you eat durian, the durian feeds your gut bacteria in a certain way that creates that heatiness and affects the circulation of your blood. We don't know. So scientists are exploring all these very exciting ideas to understand what you can do with the gut bacteria.
Dr. Gwee is absolutely right. In the past, we thought that stomach cancer is due to our genes, but now they found that it's also related to a bacteria, right? Helicobacter bacteria. So, and then last time they thought that the cervix cancer was due to your genes, and now they found that it's due to something else, another germs, right? So there are now even studies that say that whether you are fat or thin actually due to possibly bacterial infection, and whether you are smart or stupid, so-called, maybe due to this bacteria carrying all these, genetic codes, whatever, that is influencing your body. This is what I read. Could it be? This could be the reason why if you take probiotic, you sleep better. So bacteria do affect our life to a certain extent. So, ladies and gentlemen, we are coming near to the end of our talk show today. I want you to ask some questions before this expert who give insight that is not the typical one that you can read out there. Take the opportunity to ask questions, but no personal consultation, because we don't want to breach your medical confidentiality.
I have a question.
Yes.
It's okay.
Good evening, Dr. Gwee. I have problems. I think I do have this IBS, but I've been to see the doctors before, and my problem is not constipation. Actually, I mostly have diarrhea. That means every time I have food, within 15 minutes, 20 minutes, I will run to the toilet already. So every time I go to a restaurant, I make sure I know where the toilet is. So that's my problem. So every day, maybe I go to the toilet about 5 times, 6 times sometimes, more than that. So it's quite disturbing to me. So I seen doctor. They did for me a barium. They call it barium. So I want to know what's the difference between the barium and the colonoscopy. How you do this test and what's the difference?
Barium is very old technology. What they do in barium is they pump in this contrast, this barium, which is basically a heavy metal substance, which is like a bit of a porridge. They pump into your colon, turn you around to spread it, pump in some air, and then take X-ray pictures, and use that thing to coat the lining of your colon and see whether there are any bumps or depression. So bumps will be a growth, depression will be an ulcer. Okay. We hardly ever do that nowadays because it's really not as sensitive, as accurate as picking up polyps, at picking up cancer, at picking up infection. Whereas the colonoscopy, you actually have the camera inside and you're looking at the lining of the colon. You might think that it's not a nice job, but actually when you've cleaned out your colon, you look inside, it's so beautiful, it's translucent, transparent. It's nicer for most people, I would tell you.
Now you know why he like to look into the butt of somebody, patients.
And then there's no smell. By the time you clear everything,
No smell some more.
smell.
Okay.
Yes, so you have irritable bowel. Because once you've done one of those and they have what we call excluded diseases like cancers, then it's irritable bowel. Your condition actually is a very classical type of irritable bowel with diarrhea. There are several approaches to it. I mean, one of course is you can try to use probiotics to firm up your stool. The more firm your stool, the less urgency. Whereas if it's very watery and loose, you can't control. The anus has a harder time controlling a big amount of liquid. That's why when people get watery diarrhea, it's so urgent and then they get accidents and they feel very bad. But when the stools are hard, they don't come out so easy, right? So you need to kind of firm up the stool. You can use probiotics as one thing. The other way is to try to make sure that you empty out your bowels before you go out for dinner so that there's nothing left to come out. Or to avoid foods that stimulate the bowels. So for somebody who is prone to diarrhea, I would discourage them from eating oily food. Right?
I tried that and agree. A lot of diet I've been trying. The fact is that it's still the same.
You need to sit down and work it out very detailed. This general approach, often patients do find difficulty because they've been so brainwashed by a health promotion board about how healthy, how good fiber is and everything, Then they can't let go. They think like, I cannot eat my vegetable and fruit, but they're telling me to eat that. But fruits are one of the major causes for diarrhea and gas in IBS.
So that kind of advice and this kind of advice here you get is quite different, right? Yeah. Anyway, the lady here brought up a issue here. There are lots of people with IBS and really struggling. And of course, fortunately in Singapore, there is we do have what we call IBS support group. Am I right? I understand that you are one of the party involved in forming this support group. Can you just tell us a bit more about it?
Yeah, we founded this Irritable Bowel Syndrome support group just over 10 years ago because we have many sufferers like this lady who may feel frustrated. They've seen doctors and doctors give them the general healthy diet advice which didn't work, and then they're struggling. Then they want to learn from other sufferers how they manage, how they cope. And then we get fellow sufferers to come together to exchange their experiences and hopefully to help each other. But we also get professionals to come in to give what we think will be more relevant and educational groups. Actually, can I introduce Jack? Today we have with us Jack Tan, who is the Secretary General of this IBS support group. And I'd like to introduce him. Jack. We are organizing a big event coming up to raise awareness about IBS and try to bring useful educational information to the sufferers. So Jack, I think, will share some of that information with you.
Yeah, thank you. First of all, thank you for giving me this opportunity to introduce IBS support group. Well, the IBS support group, as you have heard from Dr. Gwee, has been formed 10 years ago. I think it is formed and run by people like the medical professionals like Professor Gwee and some lay professionals like me. And in the committee, and we have different people. We have lawyers, we have chartered accountants, a guy like me I'm 76 years old, and I volunteer my time because I know what it is like for people who suffer IBS, and you have heard from the lady, she's all confused, right? And the aims of the society, the group, is to help people who are suffering from IBS. Now, you have heard that 1 in 10 Singaporeans suffer from IBS. And in fact, next to the common cold, IBS is responsible for most of you staying away from work. So it affects productivity also. Now, very often, you don't talk about it because you have heard Dr. Lau say this is poor business, and you don't like to talk poor business in your social environment. And people normally, very often suffer quietly by themselves. They feel ashamed and embarrassed to talk about it. And sometimes you don't know how to communicate this to your doctor. And your doctor will prescribe, to take more fruits, be more healthy, etc. And that precipitates diarrhea and precipitates IBS. So what we do here is our aim is to educate the people, educate the patients, and let them interact with people, fellow people who have IBS, so that they know that they are not suffering alone. Hey, I am not the only one. Some other people are doing that, are suffering from IBS as well, and the same symptoms. And you can talk about it, you can learn from the experiences, and you don't feel so bad. Now, we are not stopping at only educating the patients. I think we also want to reach out to your family members. Right? Very often your family members don't understand you. Right? Why is mommy, daddy, or brothers running to the toilet all the time? And your friends don't understand you. And what is more important could be your boss may not understand you. Now we have heard of a story that, it can happen that the boss came out and says, "Where's Jack?" His colleagues say he's in the toilet. 3 or 4 times he comes and says he's always in the toilet. Now, what kind of impression has the boss on the patient, on Jack, for instance? So what happens is if we go and reach out to the bosses and educate the bosses, then they will learn to empathize with the sufferings and the pain and the problems that the patients are going through. And that has a very nice domino kind of effect, because, well, then Jack doesn't feel bad anymore because the boss understands him. And as you heard, stress is like one of the problems. So you take stress away from him, he's likely to have less IBS symptoms, and he's likely to appear more often at his desk and not stay away from work so often. So that is where we come in. Okay? Now, we do organize forums and we organize workshops. Now, we do talk about topics which would be interesting to people who suffer. I'll just read to you some of the topics that we have handled. Sorry, this is an age where I have to take off my specs. Now, some of the topics we have dealt with at the talks or workshops are digestive health help for mother and child, what IBS is about, and how some patients manage it, an update on the treatment of IBS, constipation in the elderly, what to expect on a visit to the gut doctor, functional abdominal pain in childhood, eating well for a healthy gut. That's the last one. It's very interesting for all of us, right? So, I need to see you when I talk. Well, what we are also doing now is we are trying to promote the awareness of the society, of the group, so that people will come forward and they know where they can go to if they have a problem. And to do this, we are going to organize IBS support group is going to organize what we call an IBS Awareness Week. Okay? I think we will use this also as a kind of contribution from the IBS support group towards the SG 4050. Okay, and it will be held in the month of August. Now, it will comprise of, it will kick off with a series of scientific meetings organized by Dr. Gwee and his team, and followed by 4 or 5 roadshows, right, in the main hospitals. So far, Singapore General Hospital, NUH, and Tan Tock Seng have confirmed participation. So we will be there. And the roadshows will take the whole day. We will be present there. And there will be flyers, there will be educational panels, and there will be people who are attending to the people who are visiting us. Okay? And we will then also publicize the forum that we're going to have. Because the week starts off, as I said, with the scientific meetings, and we'll wrap up with a public symposia the following week. So it will span over a week. And at the public symposia, we will be having talks, right, that will be interesting to people who have, people who think they have, and we will have workshops also. Now, in the workshop, you'll learn quite a few things. May I take a very quick time to just tell you, for instance, where sharing is very important. Now, if you look at me, you know I love to eat, period. Now, for a while, I had to stop going and enjoy my food because of my diarrhea and all sorts of related problems with IBS. But I didn't give up. I thought about it. I invented what I call an IBS kit. Now, I think with that kit, I'm able to eat because I'm no longer worried about what is going to happen. Now, I think, and I've shared this with friends, they have found it useful, and they have overcome it. So this is one way we can share experiences. I mean, doctors can guide you to that extent. You are only seeing him for half an hour for every 5 months or 6 months. I think you need the people around you for support, okay? And, well, I will hand out some flyers here. I prepared some notes here, and what you can do is, well, just a very short entrance fee is $15, annual fee is $15 a year, and to that, you can attend all the public lectures and all the workshops, and you get flyers, etc., FOC, okay? Now, the addresses are here, and you can please contact us if you're interested or you have any questions, okay? Thank you.
So that is the IBS support group, and do watch out for the IBS Awareness Week coming up soon. Remember, people with IBS, they do suffer. They go to a restaurant, they're always looking for toilet, always, urgent. So we have to think for them. And if you know people who are suffering from IBS, refer them to IBS support group so that they can be helped as well. We have come to the end of our Dr. Lowly Talkshow. There will be more talk show lined up for the rest of the year. So do look out for our talk show coming up at drlowly.com. And ladies and gentlemen, I want you to thank Dr. Gwee and Jack here with me. And thank every one of you for joining us tonight. Can we have a good picture together? And my chairman, Cecilia, come. Any announcement for the audience?
Sometimes in May, towards the end of May, we will have another talk on irritable bowel inflammation. So what we will do is that because we have all your registered emails, we will keep it posted then with all the details. Thank you.
Let's take a picture together. Thank you.
Well, I think it's important. I think you deal with it in a very simple manner. I think not with all the jargons, because if you come with all the jargons, most of the people will not understand you. So I think the approach is good, simple, not much technical terms and technicalities in it. So I think people will probably take home more in this manner. Oh, I've suffered IBS for almost 10 years now. So I have to learn to cope with it. And I think that as I had said earlier, the doctor can only help you to a certain extent. A lot of it depends on yourself. I think, you see, unfortunately, prolonged suffering from IBS can lead to depression. Right? You feel that you have heard that, you feel that not like eating out, you don't feel like going out. I have friends who stop going out completely because of IBS, and they become like a recluse. I think it's bad for them. So meeting out with people, I think having people support you, empathize with you helps. That it makes you feel that you are not the only one. There are other people who are suffering the same problems, and you feel better. April, yes, but I think it was too short a time for us to organize that. And besides, we thought it's more meaningful if we go nearer to August because of AG50, right? That's the reason why we are targeting it for August.
Today, I think some things like the new trending things, something happening like IBS. I thought I'm the only sufferer kind of thing, is it? So the perspective is changed. Now I know that a lot of people, okay, have this problem. It's not me alone. So I'm not suffering alone. Okay, that is one thing that I understand now better. Okay, and another thing is that food does affect these problems also. Okay, that's another thing. And the other one is some things about the support group. Okay, so at least there is a group of people who we can fall on, okay, to find out how the suffer, whether it's the same as us, ourselves, that kind of thing. So it's a good thing that I attended this. For me, I have no problems. Yeah, it's okay, but I think probably can elaborate a little bit more. I mean, into more details. Okay, something like when they have IBS, what is generally how the sufferer suffer. Okay, and how they recognize. It's not only like by tools, I mean physically how they feel, how to recognize an IBS. And I think that's also a good idea. If I have a free time slot, okay, definitely I will come, because generally I love to attend this type of health talks, actually.